Yes, and good morning, everyone, and welcome to the 2050 Rural and Human Service Transportation Plans Regional Workshop, focusing on the coastal Georgia region. My name is Matthew Wilson. I serve as the Mobility Manager for the Georgia Department of Transportation and as the Project Manager for this plan. And I want to thank you all again for being here this morning. Just a few virtual housekeeping tips. First, we ask that you please keep your mic on mute during the presentation. This ensures that everyone is able to hear the presentation clearly. For those using a computer or smartphone, this is the microphone icon with a slash through it. For those on the phone, we ask that you please mute your phone. As we progress through the presentation, we have scheduled breaks for questions and discussion. Please ask or provide a comment. This workshop is designed for us to better understand rural and human service transportation in your region, and your active participation is encouraged. When asking a question or making a comment during these times, please use the raised hand feature in Teams. This is the icon with the smiley face and hand. Alternatively, you can use the chat box feature to type in your question, which is in the comment bubble icon. Our team member, Jaquita, will be monitoring the hand raises and chat box during the entire workshop. If you are on the phone calling in, and you will be unable to raise your hand or use a chat box, so please, during the discussion segments, we'll ask if anyone is on the phone would like to speak. Please unmute your phone and begin speaking. A little bit about the RHST team. The 2050 RHST plan is a 3-agency plan. I will speak more about this in the coming slides. The Georgia Departments of Transportation, Human Services, and Community Health are the plan sponsors. The plan is being developed with the help of a consultant team comprised of AECOM, Cambridge Systematics, and Modern Mobility Partners. Today we're going to run through the following topics. I'll provide a brief introduction and some background on rural and human service transportation in Georgia. I will then hand it off to Will Brewer from AECOM to review the available transit and transportation services in the coastal Georgia region. After, Baird Bream from Cambridge Systematics will walk us through the region's transit needs. And then Kirsten Moat from Modern Mobility Partners will guide our discussion session. We'll also have a couple of question and discussion points throughout the workshop today. So what exactly is rural and human service transportation? Terms. Rural and human service transportation, or RHST, are mobility services provided for the benefit of disadvantaged populations, including persons with disabilities, older adults, and persons without a vehicle. RHST includes services provided by public transit operators, human service agencies, private providers, and private nonprofit agencies. The 2050 RHST plan seeks to do a few things. First, we're going to do a general update of existing conditions information from the previous plan. Then we're going to build upon the recommendations and efforts completed from that first plan to identify projects, programs, and policies to meet current and future demands. Also provide enhancements to the RHST across Georgia. I mentioned that this plan is a 3-agency plan. This is because the state of Georgia administers 3 systems to provide public transit, human services transportation, and non-emergency medical transportation. Each system is administered by a different state agency using different funding sources. GDOT focuses on public transit for rural and small urban populations. DHS focuses on transportation services for seniors, low-income families, individuals with disabilities, and vocational training, while DCH focuses on transportation to medically necessary services for eligible Medicaid members. Coordination exists at the state, regional, and local levels. However, each agency's system operates independently using a variety of service delivery models with differing requirements. The state's role in delivering transit is primarily to oversee compliance with federal grant requirements. There is no single state authority to set priorities for public transit and human services transportation, or to coordinate planning and funding of transit services for rural communities. A little bit of history on the RHST plan. Back in 2007, the Georgia Department of Human Services and Transportation completed the Coordinated Public Transit Human Services Transportation Plan. As an update to that plan, GDOT initiated the Georgia Rural and Human Services Transportation Plan 2.0 in 2011. The RHST Plan 2.0 outlined coordination activities among the rural public and human service transportation providers across the state to achieve improved service delivery to state public transportation and human service transportation customers. The plan also developed recommendations to implement mobility management at the state and regional level. In 2021, GDOT, DHS, and DCH began developing an update, the 2050 Georgia RHST plan. The purpose of this plan is to provide a framework for additional coordination among Georgia's agencies impacted by mobility services and continue the work of the Technical Coordinating Group, which is now renamed the Technical Advisory Group, and expand its participation to additional stakeholders. A quick look at our plan schedule. You can see we wrapped up our vision and goals, which I will discuss on the next slide, and we are heavy into our existing conditions and needs assessment and beginning our alternatives analysis. What I want to focus on today is how to get people involved in this process and how we can get input from your region to help us understand needs and develop solutions. The stars on the slide indicate stakeholder and public outreach events. Those with a pink circle indicate the technical advisory group meetings. Outreach is a key component of the RHST plan update and ensures the agencies updating the plan fully understand the rural and human service transportation needs across the state. The Technical Advisory Group, which includes the 3 state agencies sponsoring the plan, also includes representatives from regional commissions, the statewide Independent Living Council of Georgia, and other stakeholders identified through our stakeholder engagement process. I'm pleased to see actually a few of them attending the workshop this morning. We are engaging stakeholders and the public in each of the 12 regions in Georgia through these regional workshops. We are also conducting a statewide survey for RHST providers and a separate survey for riders, the link to which is on the QR code on the slide. These efforts will help provide all Georgians an opportunity to access the status of the RHST plan update and identify needs and service coordination strategies. Additionally, public feedback will be elicited through the 30-day public review and comment period for the draft RHST plan update, which we are targeting for July. The RHST vision and goals are structured from the statewide transit plan. Our vision statement outlines where we would like rural and human service transportation to be in 2050, which is to continue and grow statewide rural and human service transportation coordination to improve the quality of life and economic activities for all Georgians, specifically those in rural areas, those with disabilities, older adults, and persons without vehicles. Our 6 goals, again based on the statewide transit plan, outline how we seek to implement the vision. The first goal is to provide coordinated and efficient rural and human services transportation. The second is to provide a safe and sustainable RHST network. The third is to optimize public transit programs to best meet public transit systems and travelers' needs. The fourth is to ensure public transit coverage across the state to support mobility and access for all. The fifth is to connect rural transit to regional and urban centers. And finally, the sixth is to leverage technology and innovation to support public transit ridership and performance. I would now like to hand it over to Will Brewer from AECOM to help us walk through the available transit in the coastal Georgia region. Will?
Great. Thank you, Matt. Good morning, everyone. Thank you so much for being here. As Matt mentioned, my name is Will Brewer. I'm a transportation planner with the AECOM team, and I'm just going to briefly go over a few maps to show you a general snapshot of the existing transit services within your region. We have some statewide maps here, and basically we're looking at public transit, Department of Human Services, and Department of Community Health. So I'm going to zoom into your region now. So as you're quite aware, it's a rather coordinated system here with CRC. I'd say that just about every county that you were visualizing here in that first map in the 7-county region is has services provided to them for transit. We do have 2 counties that I'd like to acknowledge, of course, that have rural and urban transit, and that would be the Chatham area transit, providing services in the Savannah area, 2 circular routes, 15 fixed routes, 1 express route, 1 ferry, and paratransit. Then, of course, we have Liberty County, which provides services to Hinesville, Flemington, Waltherville, Fort Stewart with 3 fixed routes and paratransit. And of course, we really want to focus this plan on human services and DCH, those non-emergency medical trips. So those next 2 visualizations maps, again, very well covered for human services transit needs. I will mention there are 3 different parties that are involved here and all within the region. So we have our Division of Aging, our Division of Family and Children Services, our Department of Behavioral Health and Developmental Disabilities. And so, all these maps show all 7 counties provide services from those 3 parties. So we'd like you to just take a look, and as I pass it over to Kirsten, we'll see if we do have some accurate data that's being displayed here. Lastly, we have those non-emergency medical trips, those trips for medical treatment, medical evaluations, obtaining prescription drugs, obtaining medical equipment, and so forth. And there are 2 brokers that operate throughout the state of Georgia within 5 different regions. And it appears your 7-county region are all provided by Motive Care. So that's something that we want to acknowledge and talk more about with your existing conditions. So really, that's the snapshot that we wanted to provide you. So go ahead and take a look. We'll probably revisit these maps and talk more about it. But for now, I'm going to hand it over to Kirsten and go from there. Thanks so much.
Okay, thanks, Will. So we want to pause here and have a little polling exercise. For anybody who has access to a computer or a smartphone, we invite you to join our Mentimeter. And you can join either by the QR code that is on your screen, or you can go to www.menti, that's MENTI.com. And once you arrive there, it's going to prompt you to enter a numeric code. This is an 8-digit code. For those that can see the screen, you can see the number up there. For those joining by phone, it is 8 6 5 4 8 3 3 1. So we've got a couple of questions. Once you enter that code, and if you're on the phone and you do not have access to a computer or smartphone, I'm going to ask the questions, and if you would like to provide a response, you may unmute yourself and go ahead and speak. So the first question, based on the maps that we just showed you, and I'm going to refer back to them and talk about them a little bit more as you're thinking through this question, but based on the maps that we just showed you, what transportation services are we missing? Do we have everything covered? Are we accurate in what we're displaying on the screen as far as coverage, the types of transportation offered? Are there any other existing transportation services in your region that we need to be aware of? And maybe these are private transportation services. Maybe they are nonprofit transportation services provided by perhaps a church. So any transportation that's being provided to either the public or human services, population groups, primarily being aging, disabled, and persons without vehicles, or non-emergency medical transportation, those are the types of services that we're looking for in these answers. So through menti.com, MENTI, and using the code 865483331, you should be prompted to be able to answer this question now. So I'm going to go back to the slide of the maps so you can reference them as you're thinking about it. And I will invite anybody who is on the phone, if you would like to provide some input, or maybe you just have a question, we invite you to do so now. No questions so far. I'll let you keep thinking. And if you are on the phone, I have brought the maps back up. And just as a reminder, under public transit services, the entire 10-county Coastal Regional Commission is covered by some type of public transit service. We have it broken out between rural services and those that have rural and urban services. The 2 counties that have both rural and urban public transit services are Chatham County and Liberty County. The other 8 counties have rural transit service. Now, this is all a coordinated system through the Coastal Regional Commission, but each county is a subrecipient, or the Coastal Regional Commission is a subrecipient and receives the funding to provide services across all 10 counties. Similarly, all 10 counties have services through the Department of Human Services and provide transportation for aging, the Department of Family and Child Services, and the Department of Behavioral Health and Developmental Disability. So again, all 10 counties are covered. And then for non-emergency medical transportation, all 10 counties are within the same region, the East region, and the broker for the non-emergency medical transportation is Motive Care. I'm going to go back to our questions, see if we have any input. None so far. So I think that's an indication that hopefully we are reflecting this area correctly. This is what's going to be used for our existing conditions and help us with our needs assessment. So if you do end up having a comment or a question about it, we encourage you to reach out to us following this workshop, either by contacting Matthew or contacting myself. We have our contact info at the end of this presentation. I will also mention that this is being recorded, and we are going to post a copy of this workshop on the GDOT website. Okay, next question. So thinking about the existing services that you have in the Coastal Regional Commission, what kind of constraints are you currently facing? Perhaps it's you would like to expand the days that you provide service or the hours that you provide service, but you can't for reasons that may deal with funding, may deal with labor shortages, staffing shortages, driver shortages. Maybe it's a constraint on the number of vehicles. You have a lot of demand, but you don't have enough vehicles to meet that demand. Perhaps you're constrained by the age of your vehicles, and you're seeing that more of your vehicles need to be repaired, and that is taking them out of service for a day, maybe days. So again, anybody who is on the phone that would like to unmute themselves and give us some thoughts, we welcome that. If you've joined us through the menti.com polling, you may enter your questions now.
This is Don Massasek. Can you hear me? I got a question.
Sure.
Okay, my question is basically on the utilization of the vehicles to accommodate needs within a region. Case in point, employment contract runs. We're going back into that one slide on drafted vision and goals, and you have those 6 items there. And number 5 is to connect rural transit to regional urban centers, which a lot of that can be attributed to the need of access to employment. There seems to be within the departments frowned upon to do employment runs. What can we do as a regional system to, at least as long as we don't interfere with the needs of the DHS and the 5311 clients, what accommodations can be made to establish more employment runs? Now, keep in mind, as we all have a place of employment, is that you have a start time and a quitting time. So if we're doing employment runs, those people got to be to work at a certain time. And that seems to always be the #1 prerequisite when you're talking with an employer, is that I don't care what you're going to charge me. I don't care about this. They just have to be there on time. How can we address that concern for a rural area?
Yeah, I mean, I think that's a really good question. And Matt, I don't know if you want to respond. I don't know that I have an answer for you today. I think today we're trying to discover what are these constraints, and I think that's a really valid one. That there aren't as many employment runs, but as long as you don't interfere with the human services and the non-emergency medical transportation, what can be done? What kind of program or project might be implemented to assist transporting people from more rural areas to urban areas? And those are some things that we want to explore.
Yeah, I would agree with that, Kirsten and Don. That's a really great point and something we need to hear. I think part of this is us understanding each of the region's difficulties your region is very unique because you have a very coordinated system right now, and you have all of your region's coverage to all the counties. So it's a pretty unique system, and you run and operate the system. There's no third party, so that's pretty unique. And so when they're doing additional coordination services for these types of transit operations or for non-emergency medical transportation, coordinating with that system, we want to hear any of those issues, and then we can sort of follow up with those as we walk through this process.
Yeah, because we get approached by the industrial development corporations of each county that might be doing through a recruiting process or an expansion process of employers. And one of the very first questions brought up in the initial meetings is, can I have transportation for workers, for employees? And sometimes we can accommodate, sometimes we can't, but it would be nice to be able to step up to the table and have some kind of a quasi solution to that need.
Okay.
And the thing of it is, on top of it all, is that, that share that goes by our county commissioner, each one of our county puts a contributing share in. So again, that helps us be a little bit more responsive to their contribution going into the program.
Sure. Yeah. No, I think those are great comments. And so what we're going to do following these workshops is we're going to be taking all of this feedback and we're going to be doing some research to see if other programs have been implemented in any other place, either across the state or maybe even internationally, to see if we can find some best practices and see if we can come up with, perhaps a policy or a program recommendation to help address each of the issues and concerns that we're hearing during these workshops, as well as what we're hearing during the survey, which we're going to talk about what we're hearing so far in the survey a little bit later in this presentation. We did get another comment through the Mentimeter. So what are some constraints on your existing system? The age of the fleet due to the unavailability of new replacement buses. This is creating an increase in maintenance spending and downtime of the vehicles. I think this is a very valid issue. I hope that it's not an issue that lasts for a long time, but I think we all understand and recognize the supply chain issues, which has had an impact on all sorts of industries, the vehicle industry being one of the key ones. And so there's a backlog in order of new vehicles, which is causing your current vehicles to have way higher mileage than they should for their typical lifespan, which is increasing the maintenance, not only the downtime, but also the cost of maintenance, which was probably not accounted for in your budgeting. The other part of this comment is the salary increases for drivers. So I think this is something that we've heard a couple times through our other workshops, is that drivers are leaving for other jobs that are paying more. And this is putting a big constraint on the transit systems to be able to compensate their drivers competitively with other perhaps service industries. And so where do you find that funding? Especially when, if you all have been impacted by COVID and your ridership has gone down, where is your funding coming from to provide those increased salaries when perhaps your fare box revenue has been decreasing? So those are all very interrelated, interconnected concerns. So we appreciate your input. We're going to have more opportunity for discussion and questions. We have more questions for you, but not through a polling. So you can exit out of the Mentimeter. And we will open it up for discussion towards the end. I am going to turn it over to Mr. Baird Bream from Cambridge Systematics. They're leading the existing condition and needs assessment analysis for this study. And so he's going to talk to you about some of the findings that they have.
Hi, good morning, everyone. Thank you for the introduction, Kirsten. So yes, we're going to talk about the needs assessment that we are currently conducting, the quantitative and qualitative analysis of transit demand and transit priorities within the region, specifically focusing on rural and human services transportation. Before we dive into it, I just want to state up front that our methodology for this needs assessment is consistent with the needs assessment methodology used in the GDOT statewide transit plan that they conducted in 2019 and 2020. And that methodology itself is actually taken from a methodology proposed and recommended by the Transit Cooperative Research Program that gets deployed around the country. So the methodology is seen as very robust and very reliable, and it's consistent with previous methodologies produced in Georgia. So our point is that we stand behind these numbers and we feel pretty good about the approach. Next slide, please. So the quantitative aspect of the needs assessment is conducted through two main methodologies: a non-program demand assessment, which is highlighted here in blue, and a mobility gap demand assessment, which is presented here in green. Both methodologies are based on demographic information taken from the county level and aggregated to the regional level for each regional commission in Georgia. And the demographics that inform these assessments are those that are seen as a transit dependent or transit reliant, so people who are likely going to be making use of transit. On the non-program demand assessment, these demographics consist of people who are 60 and older, people with disabilities, and residents of zero vehicle households, by which we mean people who live in households where they do not have immediate access to a personal vehicle. We conduct these estimates for both 2019, which is taken as our base year, and 2050, which is taken as our long-run horizon year. The reason we're using 2019 data is because this demographic information is produced in the American Community Survey, which is a product of the US Census. It's conducted on an annual basis, but due to data cleaning, data processing activities that need to be done by the census, the most recent data that we have available is for 2019. And we align that with National Transit Database reporting from the transit agencies within each region for 2019, so that our numbers are consistent. For 2050, the horizon year, we are conducting projections of changes in some of those demographics based on projections produced by the Georgia Governor's Office of Planning and Budget, which produces population forecasts for every year between 2020 and 2065. And again, these numbers are consistent with those used in the Georgia statewide transit plan. The mobility gap demand assessment also draws on that demographic information, but takes a slightly different approach where instead of just looking at demographics, it also looks at travel behavior. And specifically, it's an estimate of the difference in the number of trips taken between a one vehicle household and a zero vehicle household. So essentially comparing those residents of households that lack consistent and reliable access to a private vehicle against the travel behavior of their neighbors and peers in those households that do have access to a vehicle. And these two methodologies essentially help us build a lower bound and an upper bound for transit demand in rural areas. This allows us to produce essentially a range of potential outcomes for analysis. And so diving into the table, what we see is that in 2019, all the rural transit agencies and providers within the coastal Georgia region provided about 128,000 trips in 2019. But based on our demographic analysis, the total rural demand for travel ranged from 138,000 trips under the non-program demand assessment to 540,000 trips under the mobility gap demand assessment. This means there's an unmet rural trip demand of about 9,700 trips under the non-program demand assessment, all the way up to 411,000 trips under the mobility gap demand assessment. And again, this sort of broad range is expected from this analysis because, again, it's showing the difference between simple demographic analysis and rider behavior analysis. Based on this existing rural trip demand, we estimate a total annual costs, both capital and operating, that is necessary to meet 100% of demand. And that ranges from $4.4 million per year for all rural transit service providers throughout the coastal Georgia region, all the way up to $17.6 million per year under the mobility gap demand assessment. Now, if that seems really high, that's kind of, again, by design. This is a very maximal approach type methodology where we're estimating the total, the costs associated with meeting the total needs. It's not a recommendation necessarily. It isn't. It isn't it's not the proposed implementation pathway. It again shows what's necessary to meet all identified demand. Now for 2050, we see an increase in that estimated rural transit trip demand from 190,000 under the non-program demand assessment all the way up to 734,000 under the mobility gap assessment. And again, this is based on projected population growth throughout the region. This means that the total annual cost of meeting 100% of demand, again, both capital and operating, ranges from $6.6 million to $25.4 million in 2050. So again, not the recommendation, just helping us understand the level of demand in this area. Next slide, please. This is another type of analysis that we're using to estimate demand, but we're treating it a little bit differently. This is the Commuter Transit Demand Assessment that specifically looks at an estimate of demand for crossing county regions in order to get to work. So this is essentially an estimate of the employment runs or the demand for employment runs, rather, that we were discussing earlier. This is also based on information taken from the US Census, but it is combined with information and estimates produced by the travel demand model that Georgia DOT uses to basically analyze trip behavior and travel behavior throughout the state. And transit demand here is actually based on a proxy estimate, specifically the number of home-based work trips. Now, home-based work trips essentially are a stand-in for transit demand because what it's taken as is a work trip that is not currently being fulfilled by a different mode of transportation. So it's a kind of hypothetical, again, maximal estimate of transit demand. And what we see here is a variety of trip patterns, all of which flow into Chatham County in order to, again, kind of fulfill that work commute requirement. What we see is a pretty robust range of demand, but we want to specify that again is by design. We recognize that there's going to be a lot of intercounty flows going back and forth throughout the region, but we focused our estimate on trips, on travel patterns that generate at least 100,000 trips per year, because that we see that as a kind of necessary volume of demand that would justify and support the capital and operating costs associated with running commuter transit. Obviously, I'm sure many of you will notice that the Liberty-Chatham corridor does not meet that threshold for 2019, but because it just gets there in 2050, we did want to include reference to it. So again, what we see is travel from Effingham to Chatham County, Bryan to Chatham, Bullock to Chatham, and Liberty to Chatham. And there's actually, it's fun to see a kind of declining volume of trips as we go down the table, but the aggregate total number of trips flowing into Chatham County from these surrounding counties exceeds 1 million per year. So again, we see a pretty robust commuter demand across all these counties, all flowing into the Chatham region, into the metro area there, in order to just get to work. So there's pretty robust demand, and this demand increases substantially going into 2050, where again, using projections for growth in travel demand, we see the demand practically double across each of these county corridors. So again, pretty robust demand for commuter transit. But we'll pivot now to the next slide and talk about our qualitative analysis.
So Baird, I'm going to take a quick break.
Oh, of course.
I want to
Thank you.
see if anybody on the line has any questions or comments. That was a lot of numbers, a lot of math that Baird and his team have been doing. So just want to see if there's any clarification that's needed, questions, comments you have.
Yeah, this is Dawn again. Go back to the previous slide, and you're dealing with parameters of 60 and older. You're dealing with the zero vehicle household and people with disabilities, right? That's the arena you're addressing in these statistics here. They'll go back to the last slide, and everything is concentrated on access to work in our urban counties. Doesn't that seem to be a conflict of the two parameters that we're looking at? The first one was those with the levels of disability, and the second one right here is showing people have access to work. If we give up those other categories to get more people to work, we get gigged. Okay, there seems to be a discrepancy between these two parameters on what we want to address. I'm not questioning the importance of the access to work. I think that's critically important because that's a have multiplier effect to it. But I just have a conflict with those two databases right there.
Yeah, we understand that. And I'm sorry, I should have clarified that these two methodologies do run in parallel and are looking at transit demand in kind of different categories. But the way the methodology is set up within the total needs assessment, and this is a piece that we're still running out, this commuter transit demand assessment piece, is that the analysis ultimately kind of treats them as rural and human services transit in the previous pieces, and commuter transit in this piece. So within like the GDOT statewide transit plan, this commuter transit demand assessment is seen as something that is more likely to be operated by something like the SRTA Express commuter services.
Okay.
So rather than,
can I interrupt that? Another question?
Yeah, please.
Is your model that you're utilizing the same model across the state of Georgia, or is it customized to fit the geography of a particular region?
That's a great question, and it's both. So, for example, what you're seeing with this commuter transit demand assessment, the numbers on daily commutes and daily commuter transit demand, that's taken directly from a county by county analysis of home-based work trips. But it's the conversion of daily commutes to transit demand relies on a standardized formula that the standardized formula does consider geographic distances between the counties. So recognizing that there's going to be a kind of decaying function the further away you get from a major.
I like your data, but for us to attain your data level, GDOT would have to agree to give us 200 buses.
Yeah. So I think what we're trying to demonstrate here is these are not recommendations. It's us just trying to understand what level of demand exists all across Georgia for all of these regions, and what exists from a rural and human services transportation standpoint, which was the previous slide, and what kind of demand exists for commuter transit. So it's more of like an existing conditions and a future needs. But as Baird mentioned, this is a maximal approach to it. So this is like trying to understand any and every demand that is out there. We recognize that the region's not going to be able to operate 200 more buses. Not only the cost of the buses,
Yeah.
but the
I've
cost
got
to
a question.
operate them, the
How can I
drivers.
get acclimated to this demand? That's all we're looking at.
Yeah, it's a lot. It's a lot, especially for, a large region like coastal that has an urbanized area that has a very attractive employment um in the Savannah metro area. So you're going to see pretty high commuter demand, but again, our recommendation is not Coastal Regional Commission needs to achieve this level of service. We recognize that there is demand here, and are there some steps, whether it's a program, a project, or a policy, that we can take to help meet some of this demand? And how do you balance the rural and human services demand that we saw in the previous versus the employment transportation demand, which is seen through the commuter transit demand? How do you balance them? What are the priorities? And what kind of programs, projects, and policies can we identify that may help alleviate, alleviate some of this demand?
Good. Thank you.
Yep.
I'm done.
No, thank you very much
No,
for your
no,
questions. It's really important context.
it is, and I think your questions really give us the opportunity to dive into this a little bit more and explain it. And so now this explanation is going to be available on the video on the website. So thank you, Don. Any other questions or clarifications from anyone else on the call? Okay, I think we're going to transition over to the qualitative things that we're hearing about needs. And Baird's going to keep going with some of our survey results.
Thank you. Yeah, so as Matt mentioned earlier, we've got our two surveys that are open right now, a provider survey and a rider survey. These represent our efforts to capture, again, that qualitative perspective, that user perspective that is incredibly valuable to getting more nuance into the specific needs and priorities of transit for these regions. So the provider survey has been issued directly to our transit providers. If you have taken the survey already, thank you so much. We appreciate your participation. If you have not, as said, there is still time to do so. It's open through the end of the month. We also encourage you to share it with your peers and your colleagues in the field. We'd really love to hear from as many providers throughout the state as possible. What we've seen so far in the survey represents a mix of, very kind of standard familiar issues within rural and human services transportation, but we do also see some emerging issues that have been brought to light through some of the impacts of COVID-19. So to start, we've heard so far that fewer than 50% of respondents are able to carry riders to destinations outside jurisdictional boundaries, like county lines or regional lines. And by a ratio of 2 to 1, respondents have not pursued coordinated human services transportation or regional transit service. Again, we encounter this a lot within rural transit provision. We understand a lot of these are smaller agencies with small staff. They may not have the administrative capacity in order to set up and kind of run those regional coordination efforts. So we're trying to be cognizant of that as we start to build our recommendations. We noticed many agencies have reported less ridership in 2020 than in 2019. 6 respondents had fewer than 5,000 trips in 2019, but this has increased to 10 for 2020. Again, we're not surprised to see this. Obviously, COVID-19 had a tremendous impact on travel demand, on travel behavior, as people lost jobs, as people weren't able to travel to the places they wanted to go due to closures, and tragically due to the loss of life as well. That there may just be fewer riders now, but it helps us understand the kind of current context that these rural transit providers are facing as they think about their future. We asked for providers to give some feedback on what sort of technologies they either are currently using or are planning to use. And the most interesting response we heard was that while only 2 respondents indicate that they currently use a smartphone app or a website for trip planning and fare payment, 8 agencies are considering adopting this tool. So we're seeing a kind of shift towards technology-centered service provision as agencies consider their future, which is great. That those tools are things that have created a lot of value and a lot of meaningful improvement for customers. We also asked about the most common state of good repair needs, and again, we see a mix of traditional issues and more emerging issues, where the most common need is simply purchasing new vehicles, the kind of classic issue around securing that available capital funding to modernize or expand the fleet. However, the second highest issue with state of good repair needs is establishing regular maintenance schedules. What we heard here is that a lot of transit providers essentially have to share their maintenance resources either with other transit providers in the region or with county governments, municipalities, community facilities that make it difficult for them to essentially schedule their maintenance when they want to, and in order to have their vehicles kind of ready to put into service. So this seems like this overlaps with some additional comments that we heard later about the challenges of attracting and retaining both drivers and mechanics, which again we see as potentially related to the COVID-19 impacts on the workforce. Everything from again, people kind of losing their jobs, changing jobs, having to step up and provide home care for family or friends, and then of course again the tragic loss of life that has just led to fewer people in the workforce in some circumstances. So it again speaks to the kind of the emerging nature of some of these challenges. We also asked for input on those most significant challenges across 3 main areas: administrative challenges, rider demand and satisfaction challenges, and funding. With administrative challenges, we heard essentially that the 2 most significant areas were compliance with state and federal reporting, which again is a kind of well-known and well-established issue within rural and human services transportation. Again, small agencies, small staff, but still have to meet a lot of reporting requirements that can be pretty complex. But then the other significant administrative challenge was, again, that attracting and retaining qualified personnel. In some of our listenings, or our workshops rather, that we've held, we've actually heard from some of the participants that their drivers are taking jobs in fast food because the fast food restaurants are paying more because they're trying to get staff too. So there's just a lot more competition than there used to be for labor within the field. Among rider demand and satisfaction, again, 2 kind of pretty standard challenges. We heard expanding service into new markets, ensuring that transit is able to go to where people need to go, want to go, but then also dealing with the public perception of transit, which again, we see as related to COVID-19 when transit vehicles were seen as unsafe spaces due to being in an enclosed space in close proximity to multiple people. People started to worry about their personal health and safety on transit vehicles in a way they hadn't previously. So again, we recognize the challenge that these agencies are facing, and we're trying to think of strategies that will help them address that public concern, that barrier to using transit. And then the most significant funding challenge that we heard was securing local capital funding, which again, very common in rural and human services transportation. We know a lot of these services are operating in small counties, with small governments where money's pretty tight. Finding the additional funding for those new investments can be hard to come by. So these are all factors that we're trying to push into to our strategy development approach. Moving to the next slide, we'll talk about the preliminary survey findings from the rider surveys. Again, these are surveys that have gone out directly to the public, looking to hear from everyone who could be using transit or is using transit in order to understand the user perspective and get feedback on those needs and priorities. We've received 55 responses to date, which we're very pleased with. That's a good, robust showing. But interestingly enough, 85% of our respondents to the survey do not currently ride transit. That's obviously very valuable insight for us. We want to understand what may be keeping people from riding transit, and it's valuable to get that insight. But at the same time, we do want to ensure that we're hearing from our riders so that we ensure that the service is meeting their needs as well, and not just chasing after those who aren't using transit, need to be or who may need to be convinced to use transit. So we're hoping to see a bit more balance by the end of the survey, but obviously we're pleased with the survey response. Among those who ride transit, their main reason for doing so is that they lack access to a vehicle. And their most common trip purposes are for work, medical appointments, and dialysis appointments, which again show the breadth of need that transit service is providing, and showing the sensitivity around a lot of these services. You're talking about critical trips for dialysis in particular. That's a chronic condition that can cause people a lot of pain if they aren't able to reach their dialysis appointments. So we're dealing with a pretty sensitive environment. We did ask people to indicate how they would travel if they weren't able to access transit, and the most common response was that they would get a ride from a friend or a family member. Again, a pretty common response in rural and human services transportation, that people will tap their social networks. The challenge, of course, is that relying on your social network may be difficult. It may be complex. It may cause burdens for those people who are providing those trips in those circumstances, since they have their own travel needs to meet. So we definitely want to see transit continue to provide that reliability and that consistency to these individuals as an alternative. Among those who do not ride transit, the two most common reasons for not doing so are that they are interested, but transit is not convenient, which again, we're used to hearing in this particular sector, since we run into those issues around how far transit can go across boundaries, what sort of service coverage they provide. But unfortunately, the other most common reason for not riding transit is that they are not interested, which again speaks to perhaps that public perception that we need to overcome and address. Among those who do ride transit, the most frequently selected challenges for using rural and human services transit is that it is not reliable enough for time-sensitive trips, like those dialysis appointments, that transit does not go to where they need to go, or that the distance to the nearest transit service is too far. So we see, again, kind of issues of that transit service coverage. How easy is it for people to access it? And then will they be able to reach their destinations that they want to go to on those vehicles? We asked people to indicate what sort of transit improvements they would want to see agencies prioritize. And the responses are very interesting, where we see a lot of demand for providing access to jobs. Once again, the employment runs, but we also see demand for providing access to healthcare and connecting different parts of the community or region. So again, that tension that you mentioned earlier is seen in these responses, that it's a variety of trips and it's covering a wide service area. So we can understand how that creates that challenge for balancing all those needs. We also asked respondents to provide important their priorities for transit technologies. And what we heard was real-time arrival information at transit stops, as well as real-time arrival information via smartphone, website, and text. So again, what people are really desiring is information about the reliability and consistency of their transit so that they can make it more reliable. They can put more trust in it for those time-sensitive trips. And that concludes our findings for these surveys. Again, they're still open through the end of the month. We encourage you to take them. We encourage you to share them with your colleagues and your constituents. And yeah, we hope to see more responses and more feedback that we can work with.
Great, thanks, Baird. So we're going to use the remainder of the workshop to open it up for general discussion. So on the screen, I've brought back up the virtual housekeeping information. So if we don't have, I don't know that we necessarily need to use the hand raise function. You can unmute and just speak up. But if you would like to raise your hand, you may. You may also use the chat box function, which is the comment bubble. And if you are on the phone, you can unmute yourself, and we would love to hear from you. So this is the time for more questions, more comments. I've got a few questions for you all to just kind of get you thinking. But this is your opportunity to tell us what we need to be looking at, what we need to be considering, what kind of programs you would like to see available and funded in your region, and so on and so forth. So just thinking about the service area and connections within the Coastal Regional Commission, what other needs do you have that we haven't identified? I think we've talked about, you know, the employment runs and the utilization of vehicles. We've talked about the vehicle shortages, the labor shortages. We've heard that. But what other needs do you have that would make your life easier? I'll let you keep thinking about it. And then, you know, you all have a very well connected and coordinated system. But are you finding that you have some missing connections? Are you finding that you need to provide transportation services maybe to other regions in Georgia?
We've got a hand raised from Don. Don, go ahead with your question.
Okay, first of all, I want to apologize for not raising my hand.
It's okay.
Okay, because I'm not real literate on the electronic devices here. Okay,
But you're doing a great job. I see your hand raised now.
But yeah, I think you touched on a really critical item, and dealing with the DHS and GDOT, they've been pretty good about it too. But often we are approached about going outside our region, and I think if we could, and abutting our region are a lot of the counties that really don't have any access service at all, and it would be nice if we were given the latitude to go in there and perhaps negotiate with those counties or those areas that we could provide some kind of secondary service to meet their needs. That would be great, as opposed to them having to go out and start their own system, because they just don't have the revenue base to go ahead and put a full system in. That would be good if we were given the green light to go ahead and negotiate that. And again, one of the other things we've done under the DHS component, and it goes across the board really during this COVID thing, is that there was a quality of life component. And I think that's really the foundation that we try to utilize here in the coastal region, is that every one of these trips, regardless if it's DHS or GDOT, is a quality of life trip, whether it's employment, dialysis runs, whatever the case may be. And I think that's where we need some more latitude to go ahead and design systems that fit the geography. That perhaps in my biggest premise is that let us have the ability to customize a system to fit the geography which includes all the demographics of that geography. Other than that, great presentation. I apologize for being interruptive and perhaps being a nuisance, but thank you very much.
No, we appreciate your comments and input. You know the saying, squeaky wheel gets the grease. You know, this is your opportunity to tell us what you want, and then we go back, we do a bunch of research, and we say, okay, here's some things we think we can do to meet the needs and desires of each one of these regions. I was just looking back at my notes. I was going to ask you a quick question. We heard from another region, I think it was the Atlanta region, that during COVID, they didn't have as many riders, obviously. So instead, what they were doing is providing meals to seniors and perhaps other groups of people during COVID, because those people were unable to get out and get to the services and meals that they needed. Did Coastal Regional Commission do anything similar to that, where instead of providing transportation to people, you were delivering meals to those people?
Yeah, yes, we did. And David or Jimmy can probably address that even further detail. But yeah, we did a lot of Meals on Wheels delivery through our DHS program.
Okay, as a follow-up question to that, and are you finding it is tough to balance the meal delivery and providing those transportation rides now that people are starting to go back to medical appointments, yet with these different variants, people are still staying at home and still need those meals?
David, can you address that?
Yeah, I can jump in here. The meal delivery we did was basically during times when our senior centers were closed to their attendees. So they were still receiving funding for providing the meals, but they didn't have a way to provide those people meals. So they were fixing the meals or either daily or for weekly groceries. And we were delivering those depending on which senior center. Some of them were doing weekly and some of them were doing daily. But now that the senior centers are open back up and they have attendees, we're not really providing that service. We're back to providing transportation for those riders, those attendees to go back to the centers.
Okay.
Instead. So it was kind of a replacement trips for trips that we would have been normally doing, but that we're not, those have moved back in the other direction.
Okay. Very good. Thank you. That's helpful. So I think I've been most excited about asking you guys questions about your coordinated system for this workshop. So, we know that there's still a lot of areas across the state that have uncoordinated systems. You all have been a pioneer in a coordinated transportation system. I just have to mention that, like, when I was working on this plan 10 years ago, I was working with Miss Barbara Rhst, who was really the leader in getting your system up and going and coordinated. And she was amazing to work with, especially as a little green entry-level transportation planner that I was. But I'd like to hear from you on, as you have continued to grow this coordinated system, as you've transitioned from a third-party operator to bringing your operations in-house, can you tell us some of the lessons learned or challenges you ran into, some barriers that you had to overcome, and maybe kind of how you overcame some of those?
David, you want to go first?
Sure. A big thing is, as far as transitioning to running everything in-house, I think that was a good move for us. Less oversight of a third-party operator, streamlined things for us. On the other hand of that same equation is having to be more involved in the management of the drivers, employees, and the everyday operation put more of a burden on our operational staff here. But, you know, it's a trade-off, and I think we have better oversight doing it in-house.
Mhm.
And, you know, along those same lines, one of the burdens of bringing all of those people on board as CRC employees versus contract employees or employees of a contractor, third-party operator, is all of the added costs involved with benefits and, you know, things like that that drive our employee pricing up as far as our operational pricing, which makes it harder. So if we have, it makes their decisions based on whether you're doing full-time or part-time drivers and what their scheduling can be, managing overtime, things like that. The management of the employees has been maybe not a burden, but it's been more difficult than it was obviously when we're just managing the contract with the third-party operator.
Yeah, I mean, you're managing a business.
Yep.
It's running a business.
It was running a business, right? And it's everything in the house, which honestly I like it better.
Cameron, do you have anything you want to add?
But it's more controllable.
Okay.
Cameron, Jimmy?
I do not know.
Okay. The thing about bringing it in-house is again, you got to go back for that local contribution to make the system whole. And your level of accountability, your efficiency, and effectiveness of your delivery system is much, much better, okay? Because in some cases, what we found historically is that the third party was chasing the dollars, whereas if we bring it in-house, we're basically not chasing the dollars, we're chasing the service. Because if you have one dissatisfied customer, first one you hear back other than them is your board member. So I think the level of accountability is much more enhanced by bringing it in-house. And again, by bringing it in-house, is like we had the arenas that we got to serve. Is that the DHS? We also have that program in-house. So we have that coordination at the regional level that might not be, you know, so astute in some of the other areas. So by bringing more in-house, we meet on a regular basis, and we, you know, identify problems, we correct the problems, and move forward from that standpoint.
Okay. Question about the coordinated service. So I understand that y'all are providing some of the non-emergency medical transportation for Medicaid. Is that correct?
In some cases, by request.
By request. Okay. We had another region kind of they would like to get into that and do purchase of service contracts with community health. And they weren't really sure where to get started. So we told them that we thought that y'all were doing some of that, and told them that we would be able to get you guys in contact with one another so you can tell them kind of how you do that.
Yeah, we basically through approached by one of those providers, and we do a coordinated service, yeah, by request.
Okay. Okay. That's good to know. Trying to think what other questions I have about coordinated service. I may be misremembering, but are you all using the Let's Ride app?
We have it available for our ridership. We're having some growing pains as far as making sure it's all working right for somebody to log in. We haven't had many requests. The majority of our ridership is the aging population, so there's not as much interest in it for us at this point. We're getting a little bit of uptick in Camden County because Camden County has instituted a program with some of their CARES funding to help pay for 5311 trips in the county. So
Okay.
we're getting a little uptick in 5311 ridership there, and we've had a couple inquiries about it, and we're ironing out some operation with it there. Where we think it's going to really be beneficial to us is whenever we do get our buses in for our Statesboro system. You know, we're looking at a hybrid flex route system for Statesboro with 4 buses there, coordinating with the city. And we've got 4 buses on order that should have been here a year ago. So I I'll try to stop harping on that. So yeah, we're gonna have.
But David
flex
brings up a
routes.
key reference point on the matters of coordination. Is there was the city of Statesboro, okay? They didn't quite reach the threshold, but with the vision from GDOT, and GDOT was really the one that really promoted and facilitated this whole approach, is that we have a hybrid system we put into place. And we would like to see that replicated more often because it's just more responsive to the demand, to the need.
Yeah, so you talk about flex demand. Is it kind of like will it, once you have the vehicles and you have this Let's Ride app issues ironed out, will it operate kind of like a micro transit or mobility on demand service where
I don't particularly coincide with the micro definitions. I'm more or less a hybrid because the micro, from my understanding, was thrown out all other kind of options for transportation, and they were thrown in those what are those the three services out there that were extraordinarily expensive, whereas our hybrid system is that basically we're not confined at the parameters under the 5311 guidelines or the DHS guidelines. You just can respond to a user need. Gotcha. That's what we're looking for is hybrid.
Okay.
So basically we're setting it up as a flex route. So we'll have basically two routes in the city of Statesboro with the availability for those vehicles to flex off of route on demand.
Mm-hmm.
So we're a hybrid between fixed and demand response, really.
Yeah.
So it falls in that flex route kind of category.
Okay.
One of the things, going back to challenges on coordination, when you look at the way funding is and route planning and things like that are for a multi-county system versus a single county system, our oversight of our vehicles and drivers and routes and all of these things, sometimes we feel, it's been designed to be a single county system from the upper levels. The thought was always when this was built was these are going to be single county, small rural counties that need, 3 vans or 5 vans or whatever. When you're talking about you scale it up to a 10 county system where you've got 60 plus vehicles across 5,500 square miles, some of those coordinating efforts and some of the trip planning and things like that is a much more difficult task. And that's definitely one of the challenges when you're talking about multi-county trips and things like that. It's definitely a challenge over a single county system who may not have the demand or may not have to worry about going 3 counties over with one person. One of the items of feedback we've gotten from people from day one is, hey, we see your buses aren't full. Why aren't your buses full?
Mm-hmm.
They don't realize is the schedule for that vehicle may be full, even if there's only 2 people on it. It may have to go 45 minutes one direction and in an hour back the other direction to take care of those 2 people, and we don't have time to pick up somebody else. And when Don talked about scaling our system to work for our demand, one of the things we're looking at, or we have looked at in the past, is what's our vehicle need look like? Do we need cutaways? Do we need minivans? Do we need transits? And we got 4 transits on the last time we got vehicles 2 years ago. We got 4 of the transit vans, and we've been using those. But what we're seeing is those are great for employment and great for certain services, but they're really not good for a senior center service because they don't have the room to move around if you have to have limited mobility, if you have a walker, if so we're kind of learning on the fly on what our vehicle design kind of needs to be across the board, and it can vary between different counties, have different needs, but to make sure we're trying to keep our economies of scale going and make sure we're trying to service the same types of vehicles and the same tires and the same, trying to make our fleet the right thing for us is something we're always looking at.
So based on your challenges of scaling up to this level and just the number of vehicles it takes and the distance of some of your trips, if you were talking to a region that had an uncoordinated system and already had single county rural transit, would you recommend to them kind of an incremental or phased approach to coordination to kind of build themselves up to the scale that you guys are at, or do they just, if they have a whole region that's interested in it, bite the bullet and just go 100% coordinated across the region?
I think it really depends on the buy-in from the counties involved and what their goals are. If their goals are to, you know, try to save money on transit services versus trying to increase service, you know, there's so many different ways, and different people in different counties think about it in different ways, and they have different goals and objectives.
Yeah, I'm just thinking from an operational standpoint.
Yeah.
And we made that reference point to two areas. When the Brunswick's still trying to get their system into place, and we made that recommendation to the consultant, which they did in the last, reduce the size of the buses they were going after. Also within Hinesville, they were using large buses and running a major deficit, and we coordinate with them and then bring it down to a smaller level bus, and we're doing some more with them. But yeah, I mean, if I was going to inject a recommendation, is start small and grow big. Don't go big and then go broke.
I like that.
You know, yeah. So it is. What's the demand at that point in time? But you need to have the flexibility to get a 12-passenger bus or a van, or you need to have that flexibility in the purchasing, the procurement process. We should. I mean, that's always we've been advocating that, is that allow us to procure based on our demand at that point in time.
Okay. This is great. Thank you. So it is 11:16. I do want to be respectful of everybody's time. I had a few other questions, more on the administrative side, and if you've got some thoughts on any of these. So are you finding the costs to the rider is preventing you from getting more riders? Do you have any operating or administrative needs? Do you have training needs? And then the ultimate question, if you had $1 million, how would you spend it? We can take a couple minutes on these questions, but we've got a couple final slides to wrap it up. So let's focus on question number 5. If you had $1 million, if you got another $1 million tomorrow, how would you guys spend it?
The program manager should have a Corvette. More buses, more vans.
More vans.
More vans. And then also from the standpoint of the more vans to be more responsive to community needs, is perhaps a hybrid system that we're going to be doing within Statesboro. Mm-hmm. You may not have fixed bus stops, but you might have collaborated areas where people could gather and get picked up. Okay, so a little bit more efficiency. But yeah, mine would be definitely on the standpoint of vehicles.
I would add some employee retention efforts in there as well as vehicles, recruitment and retention. How do we do that better, and how do we offer them a more compensation for what they do? It's a tough job, and it's a lot of responsibility for what we're able to pay right now. Mm-hmm. But you know, that's vehicles and people to operate those vehicles is our two main things.
Kind of critical to having a transportation service, huh?
Right. You can't transport somebody if you don't have a bus.
Until they're all autonomous and driverless. Okay. Well, this has been fantastic. So Matt, I'm going to turn it back over to you to wrap us up.
Awesome. Thank you so much. Yes, this has been an amazing discussion, and one of the more lively ones we've had thus far. So really appreciate that, Don and David and the team. Really appreciate your input on this. So to review our schedule one more time, we are working on the existing conditions assessment and the alternative analysis now, and we'll start the development of the final draft report in the coming months. We are targeting July for publishing the draft final report on our website for that public comment. Once again, I want to thank you guys so much for your participation in the workshop today. Please don't hesitate to reach out to me or to Kirsten with any questions or comments. on the information we discussed today. Also, I think you guys complete our survey for the providers, but also make sure any riders that you have know of our survey. We ask you complete that before the end of February. And then if you are have any other questions, please go to our website. We regularly update that website as well. And again, thank you all so much for the time this morning.